But the fact is, the U.S., for industrialized countries, has one of the highest infant and maternal mortality rates in the world.
You're absolutely right in terms of the statistics.
Yes, in
that
terms
I
of the
saw.
statistics. And I think there are a couple of different reasons for that are postulated by medical researchers. Number one is uneven access
to healthcare.
Quality health care and health care information. That is pretty much an issue that cuts across ethnic groups. And then you add on to that different layer social factors that might hit particular ethnic groups very hard.
Now, before we get into that, some people might say, if it's a matter of access to healthcare and information, they might say, well, can't people take individual initiative? For example, on the computer, can't people just go on and get health information?
Well, that's why I wanted to talk about some of the other factors, because they do prevent people from having access. And so poverty is a huge factor. Poor people tend to have less access to high quality health care across the world. In the U.S., it's no different. Another factor is perhaps environmental factors. Also,
for example, what do you mean by environmental?
Environmental toxins that some medical researchers are looking into in the U.S. that might be in water, in food, pollution, that can promote poor health for mothers and preterm births.
Now, wouldn't that wouldn't just affect people in poor neighborhoods?
No, it wouldn't, but I'm kind of cutting back on layers and layers of this issue. It's quite complex, and usually these factors work together in some particular way. But your initial question was, why is the U.S. infant mortality rate so high given its relative wealth? And these are some of the factors that medical researchers are looking at. So generally speaking, poorer communities have worse health outcomes, including infant and maternal health. But there's a really vexing complication and mystery when it comes to African and African American women.
Okay, we'll get to that.
If I add to why, even though the information is available, or even the health services are available, I'll take one good example. If you look for the immigrants coming from Africa, there are a lot of people, English is second language. So even if the information is out there or online, then language barrier is one of the things.
Now, there are translators online, some people would say, so isn't that helpful?
Right. Even though it is translated maybe to Somali, Amharic, Tigrayan, all those languages, there are people who, even from the get-go, are not even literate in their own language. They cannot read or write the Somali or Amharic.
Or even have internet access to get that information.
So the literacy rate is very low, even though translated to the Somali or whatever ethnic language.
Now, some people would say, whose fault is that? If people have a low literacy rate, who's to blame for that if they're immigrants into this country?
Well, I don't even think, I mean, you go ahead.
I think it's not an issue whose fault it is.
Exactly.
And I don't think one has to be blaming one. But it is the right for every individual to have access to health services. But if the person would not be able to have that access, I think it's not saying that here we translate it. It is out there if anybody wants. But if the person doesn't have the capacity, then it is the issue comes how we can build the capacity for that community to have access to the health without blaming anyone.
Okay, now, just to follow up on something that you said, or that the mortality rate is high in African countries, so when immigrants come to this country, since the standards are higher, wouldn't the infant mortality rate go down?
Well, this is what I was getting at when I referred to the very vexing complication around infant mortality for African immigrants and African Americans. First of all, African American women, whether educated, at a population level, that doesn't mean every individual African American woman, even affluent ones who are educated have health access, have 2.5 times the rate of infant mortality than white women. And that's a medical fact, and that's true in almost every single state in the U.S.
Now,
And increasingly, to get at your question, the research is finding that the daughters of African immigrant women who may be coming from countries that have high infant mortality rate, high poverty, civil conflict, second generation African immigrant women have the same level of infant mortality as African American women. So their mothers' mortality rates could have been better when they first came to Africa, say came from Africa 20 years ago, but now, having become acclimated to America, the lifestyle here, the healthcare system, you could be an educated
Well,
African immigrant woman and have a higher infant mortality rate than your mother.
well, I should tell you quite frankly that I had an infant daughter who died. So I fit into that category. And it's not a matter of poverty. It's not a matter of a
Right.
lack of education. For me,
Right.
it's not a matter of lack of health access.
Right.
So I'm just putting out there that I find this to be personally a very interesting conversation. So my question would be then, given you said it's not a matter of affluence, it's not a matter of education.
For Africans and African Americans.
Yes, it's not a matter of education. Then how do you explain it?
Well, I'll tell
And
you.
presumably, those who are more affluent also have access to better health care
Yes.
and information. So how do you explain it?
I'll tell you how the medical research is explaining it. It is claimed that stresses related to acclimating to the U.S., but also the stresses related to structural and institutional racism in the U.S. have a generational biochemical impact on the bodies of African American women, causing them to emit a stress hormone that triggers preterm labor. And with preterm labor, of course, you get low birth weight babies. And low birth weight babies have a higher risk of, if they survive, birth defects, but they tend not to live beyond the first year. And the higher incidence of preterm babies, some medical researchers claim caused by endemic generational stress of institutional racism, and in the case of Black immigrants, the additional stresses that come with adjusting to America as a Black person is causing this challenge, this
Now-
mysterious challenge
now,
of
I find
high
it-
infant mortality.
I always, in my position, have to take the devil's advocate role, but some would say, why is there a need to blame everything on racism?
Well, I don't think this is blaming everything on racism, and this is based on medical research that was done primarily by Johns Hopkins, that university, and it's a multi-year study, as documented in a PBS film that we've been using called Unnatural Causes, that looks at variables of income, race, healthcare access, and concludes scientifically that, and also looking at the biochemistry of African American women at different levels of income, that this racism, and it's not just contemporary racism, they're actually claiming that generational racism has impacted the biochemistry of African descent women differently, whereby we are prone to have higher incidences of preterm births triggered by stress hormones. It is a theory that is very prominent, that is accepted in many parts of the medical community. And it's not a knee-jerk theory. It is a scientifically researched conclusion that's being derived from the data. There is debate in the medical community about, what the actual cause is, the final answer really relates to this complex of history, biochemistry, perhaps environment. But I think what's most important is to recognize that whatever the actual reason is, the fact is our community, even those with the best access, factually have much higher rates
Now,
of infant mortality.
we have some statistics that we could look at to compare what's going on with Latinos, what's going on with African Americans, and what's going on with whites. And I'm wondering, that particular slide, well, in that graph, and we can't see it very clearly from here, the highest graph is that of African Americans, and I think that's the lightest one. And the lowest one is of Caucasians. Now, those rates are going down. They're going down for everybody, and it said there is a slight increase in infant mortality with Caucasians.
Mm-hmm.
Are you aware of that?
I have heard that. I don't know that there's any conclusion about why that might be happening. The one theory that I have heard that's being researched is that it might be to due to a higher rate of poverty in some states that is a result of the long-term recession. But I'm not exactly sure, or nor is the medical community exactly sure what that statistic indicates.
So how is it that an increase in Caucasian infant mortality might be blamed on poverty, but any increases in those for African Americans or Latinos would be blamed on other factors?
Well, that's not actually a factually true statement. I mean, I think that the medical research that I have read is actually looking at all of the factors and deriving conclusions from what the facts say. So it's not like they start off saying we're going to blame it on race for African Americans and on immigration for Latinos and on poverty for whites. Generally, even African American women who are affluent, who have a higher infant mortality rate than the average, are doing better than the poorest women from any community. And so I think it's really important to look at all of the facts and derive conclusions that are based on the entire set of data and experiences.